So, hello, good evening, everyone. Welcome to the next portions. What we will be discussing today is the most important part of your anatomy, that is your tongue, muscles of head and neck. Especially these muscles of head and neck, you should know almost entire gross anatomy. Starting from your scalp chapter, you should know the muscles of facial expression. Then you should know the muscles of the mastication, extremely important. Then the muscles of the pharynx, muscles of tongue. So as in when we read muscles of the orbit also. So there are many more areas where you have to concentrate on. So these are the 4 or 5 topics, important ones which I told you. So let's go through it. Okay, one by one we'll go through it and you will dissect it when it comes. So here first thing in the muscle section, what you should be knowing is all the muscles are grouped in one category. All of them will be supplied by one nerve except one exception will be there, which is supplied by something else. So that is the one what you should be knowing. And then you should know the origin insertion of these muscles. So in the name only, when the muscle is there, the name only it will tell. The first word, for example, hyoglossus. So hyo plus glossus. So hyo means the origin, glosso means the insertion. So the name is dissected into 2 parts. So that is how we'll be discussing. So coming first to the tongue chapter. So you should have the basic understanding of the gross anatomy, that the tongue is divided into 2 parts what you study. Surfaces wise, the upper surface what you see is called the dorsum of the tongue and the lower part is called the inferior surface. On the dorsum of the tongue, all the taste buds are present. So you have got major 3 taste buds, that is circumvallate, fungiform, filiform papillae. And then you've got one more, that is foliate papillae, that is just in front of sulcus terminalis, but the name is papillae, but it is not a taste buds. So I'm just giving you a brief outline so that when we start solving the MCQs, it will be easy. Okay, so in our previous section, I used to teach the theory part first and then used to go for the MCQs. So today, as and when the MCQ comes, we'll be discussing, because today muscles of head and neck is the vast thing. I can't teach 10 topics today. So MCQ based, question by question, we'll go. So okay, so let's start now. The first question of the day. Tongue is developed from pharyngeal arches. So this question is basically from embryology. So you should know the first arch, second arch, third arch, fourth arch, and the sixth arch, everything. The whole table is there in the embryology, and when we discuss embryology section, you should learn complete. So as you know that the development of tongue, which is from 2 lingual swellings and 1 midline swelling called tuberculum impar. That is the next slide what I am telling. So let's solve the answer first. So tongue is developed from which pharyngeal arches? So it is basically 1, 2, 3, 4. But the second one, the second arch, it gets embedded down. It goes down. And it on the dorsum, it looks like 1, 3, 4. So first arch, third arch, fourth arch. The second arch also has a contribution in the beginning stages, but it sinks down. So please understand 1, 3, 4 is the correct answer. So let's go into details of this. So as I told you, the development of the tongue, you should know this diagram, which is there in your Inderbeer Singh book also. So there is 2 lingual swellings and 1 midline swelling called tuberculum impar. So what happens? Anterior 2/3 of the tongue and the posterior 1/3 of the tongue, which you know that. So from the first arch, the 2 lingual swelling and tubercle impar, which will be the green color one what you are seeing, it will be there in the first arch. So this represents the anterior 2/3 of the tongue. Then your third arch is the hypobrachial eminence, which has got again 2 parts, the cranial and the caudal part. So that forms the posterior 1/3 of the tongue. So the color coding is also there. You can relate with the color coding. And the fourth arch, which is in yellow color, they form the posterior most part of the tongue, the last part of the tongue. So this is the diagram which you should learn. There are very easy diagrams also there in your textbooks. Please learn from there also. So basically the questions which is asked in previous year are something like this: the anterior 2/3 of the tongue, from where they develop; posterior 1/3, from where they develop. So anterior 2/3 develop from two lingual swelling and cubicle impar of the first arch. So that is the contribution of the first arch. 1, 3, 4. So first arch, there is contribution is anterior 2/3. And then posterior 1/3 is from the third arch, developed from the hypobrachial eminence. So third arch contribution is posterior 1/3. And the fourth arch forms the posterior most part of the tongue. So what they ask, the other way of asking is the nerve supply. So in anterior 2/3 of the tongue, lingual nerve, which is a branch of the mandibular nerve, that is the trigeminal nerve, very important, is the pretraumatic. And cauda tympani, which is a branch of the facial nerve, is the post-traumatic. Oh, sorry, I went the other way. Lingual nerve is the post-traumatic and cauda tympani is the pre-traumatic. So, traumatic means they are continuous with the succeeding arches. One will give for the previous arch, other will give for the next arch also. So posterior 1/3 of the tongue is supplied by glossopharyngeal nerve, that is your ninth cranial nerve. So anterior 2/3 of the tongue, fifth and seventh. Lingual nerve is fifth cranial nerve, cauda tympani is seventh cranial nerve. So 5 and 7 over here. Posterior 1/3 of the tongue, glossopharyngeal, that is your ninth cranial nerve. And the posterior most part of the tongue, fourth arch, and that is vagus, that is your 10th cranial nerve. So tongue is an organ where 5, 7, 9, 10. So these 4 nerves are supplying there. And the muscles of the tongue supplied by your 12th cranial nerve, that is your hypoglossal nerve. Except paratoglossus, so which is supplied by 11th nerve. So 5, 7, 9, 10, 11, 12. This many nerves supply the tongue. So that's why tongue is a very important organ in assessment of fractures or trauma also. Which cranial nerve is working, not working. In the cranial nerve examination, the tongue is an organ which gives a lot of information about 6 cranial nerves. So some past year questions. Posterior 1/3 of the tongue is supplied by. So that is directly from this table you can tell now. The posterior 1/3 of the tongue. So I want you people to answer also. Okay, so if you answer, it will be good for you. So there will be a participation. Otherwise, just you're watching a video, something is talking, something is going on, and things will go beyond your head. So active participation is very important. Don't think that, let me hear, I will do it later. That never happens. It's all up to you, your participation. So posterior 1/3 of the tongue is supplied by the 9th cranial nerve. And the tongue muscles develop from occipital myotome. Extremely important, occipital myotomes. Right, so this part you should learn a little more. So basically, this is the embryology part. What we are discussing, the first question is the embryology part. Again, in embryology section, we will discuss this also. So a lot of more questions can be generated from here. So please go back and read this part in more detail. Next question. The main arterial supply of the tongue. Okay, so the tongue is in your mouth, and we know that external carotid artery supplies head and neck. So basically, some of the 8 branches of external carotid artery only has to supply the tongue. So external carotid artery 8. Now you have to be more specific. Ascending palatine, ascending pharyngeal, lingual, facial. So the second, third, and fourth option are all branches of external carotid artery. But here it's clearly evident main arterial supply of the tongue is nothing. The diagram is also there. The diagram actually will not be there in your MCQ question. This is for an explanation point of view I have written. Or they may blur that and then they will tell you identify the nerve. Artery, sorry. So the arterial question. So the question answer is lingual artery. So what is this lingual artery? This lingual artery is the anterior branch of external carotid artery. Anterior branch, okay? And this external carotid artery is the branch of right common carotid artery, which is a branch of right brachiocephalic artery, which is a branch of arch of aorta. Right? So that is the basic things what you should know. Lingual artery is the principal or the main arterial supply of the tongue. So then lingual artery is the branch of external, which I just told you. I told you it is the main arterial supply. So what are the other ones? The other part of the tongue, that is the root of the tongue, the back side, is supplied by tonsillar and ascending pharyngeal artery. These are branches of facial artery. Tonsillar and ascending pharyngeal artery, branches of facial artery. So the branches of facial artery in the neck region are four: ascending pharyngeal, tonsillar, glandular, submental. So this is your tonsillar and ascending pharyngeal artery supply the root of the tongue. So the lingual artery is the main arterial supply. And the venous drainage is mainly by deep lingual veins. So these are all PYQs to help you out to concentrate on this particular portion of the tongue chapter. Next question. I told you in the beginning of the class today, muscles, all of them are supplied by one except one, like that exceptions will be there. So some 7 or 8 like this category questions are there in your gross anatomy. This is one among them. Hypoglossal nerve, which is the 12th cranial nerve, it supplies all the muscles of the tongue except. Now, first you should know muscles of the tongue. The muscles of the tongue, there are two types of muscles: intrinsic muscles, extrinsic muscles. Intrinsic muscles are 4, extrinsic muscles are also 4. The intrinsic muscles are superior longitudinal muscle, inferior longitudinal muscle, transverse muscle, and verticalis or vertical muscle. Whereas the external muscles are genioglossus, hyoglossus, styloglossus, palatoglossus. So if you look at the options, the first one is an intrinsic muscle. Second, third, fourth options are extrinsic muscles. So this is just given you to confuse you. So here, hypoglossal nerve, that is the 12th cranial nerve, it supplies all the muscles, 8 muscles, but except one, and that is palatoglossus. So the answer is except palatoglossus. So all superior longitudinal, inferior longitudinal, transverse, verticalis, genioglossus, hyoglossus, except palatoglossus, and styloglossus also, except palatoglossus, that is supplied by hypoglossal nerve. So hypoglossal nerves, sorry, except palatoglossus. So palatoglossus muscle, from where does this get the connection? It gets connection from the 10th cranial nerve. So all the muscles of the tongue are innervated by 12th cranial nerve except palatoglossus, which is supplied by pharyngeal plexus, that is your from the vagus, that is the 10th cranial nerve. So all of the muscles are supplied by 12 except palatoglossus, which is supplied by the 10th vagus, pharyngeal plexus. So next PYQ is hypoglossal nerve is a nerve with what function? Purely motor function. So now the purpose of this question doesn't end here. Now you should know 1 to 12 cranial nerves. How many are sensory? How many are motor? How many are mixed? So this comes under motor category. Okay, so you have to read in and around all those things. So one muscle given, the nerve supply of others also you should know. So if hypoglossal nerve is motor, what is the other cranial nerves? So like that, you should know in and around the topic. Okay. So the nerve what we have, we are talking about is the hypoglossal nerve. So it basically supplies tongue. So let us study the whole summary of the tongue. And when it comes to nerve supply of the tongue, I told you multiple nerves are involved. So it helps in your diagnosis, that is your fractures and all, for your what you call it, assessment of the cranial nerves. you get the tongue has a very important indicator. So the sensory nerve supply of the tongue is by the lingual nerve, that is a branch of mandibular nerve, fifth cranial nerve, that is sensory for the anterior two-thirds of the tongue. And the sensory for the posterior one-third of the tongue is glossopharyngeal. So this chart, this table is extremely important. The motor nerve supply for all the muscles except palatoglossus is the 12th cranial nerve. Palatoglossus is the cranial part of palatoglossus is the pharyngeal part, pharyngeal plexus of the vagus, and then taste anterior two-thirds is supplied by chorda tympani. This is the facial nerve branch, which is a special characteristics. Okay, so that is basically the taste buds and all. And posterior one-third is by glossopharyngeal nerve. In the posterior most part vagus, that is your 10th cranial nerve. So you have got lingual nerve, the 5th cranial nerve, glossopharyngeal, the 9th cranial nerve, hypoglossal, the 12th cranial nerve, accessory, the 11th cranial nerve. Then chorda tympani nerve is the branch of the facial nerve for anterior two-thirds, taste sensation special, the posterior most part of the tongue supplied by vagus. So this is the exact correct answer, right? Don't get confused. In some other places, some other answers may be given. This is what you have to stick to. So some PYQs. All of the following cranial nerves transmit taste sensations to the brain except. So it's just derived from this chart only. So ninth nerve, glossopharyngeal. 10th is your vagus. 5th is trigeminal. And then 7th. This is your taste sensations except they are asking. Right. So which of them is the exception? So you see here the taste sensation anterior two-thirds chorda tympani. So chorda tympani is a branch of facial nerve. So fourth answer is correct. Posterior one-third by glossopharyngeal nerve. Glossopharyngeal is 9. The first option is correct. And the posterior most part of the tongue is supplied by the vagus nerve. So your vagus nerve is your 10th cranial nerve. So 10th is your correct nerve. So taste sensation is not by the 5th cranial nerve, but is only the sensory. So please understand and do not get confused. This table, which is there on your left hand side, that you should learn properly. Next question, lingual nerve supply tongue is a branch of, it's not facial nerve, it's wrongly written here. Lingual nerve is a branch of mandibular nerve. Okay, so this is the wrong thing written here. I will correct it. Please do not take this. This is the mandibular nerve. Okay, next question. Yes, so this question you would have studied in your DADH also. Which part of the tongue is associated with sweet perception? So that the parts of the tongue you have to divide. So here the tip of the tongue is sweet and salt. The lateral parts are for the sour. Central part is sweet, and the last part, posterior towards your sulcus terminalis, is the bitter part. So that is what the explanation tells. The part of the tongue which is with a sweet perception, tip, side, back, palatoglossal arch. So it's basically the tip, sweet and salt. Okay. So same explanations are given here. So this is for your understanding. Please learn it perfectly. Do not get confused. Nerve supply of circumvallate papillae. Very, very, very important, I told you. So basically it is your glossopharyngeal nerve. So glossopharyngeal nerve is your 9th cranial nerve, right? So it's the 9th glossopharyngeal nerve. Just now we have discussed this. So same thing. The fungiform papillae are supplied by chorda tympani, which is a branch of 7th cranial nerve. Posterior circumvallate papillae by the, again, papillae individual they are talking about. Anterior fungiform papillae by the 7th nerve, chorda tympani. Posterior circumvallate by the glossopharyngeal. And foliate papillae by both 7th and 9th. So this is the same thing which was there in the chart also. To learn this, understand this, do not have any confusion. The whole high yielding facts related to this topic is there in this slide. Read it again and again and again if any confusions. Then the next question what they ask is, on the structure or the shape of the papillae. So I told you there are 4 papillae, but 3 are taste buds. The foliate papillae is not the taste bud. It is included in the papillae, it is included in taste buds, but it does not do the function of taste buds. Please understand that. Only fungiform, circumvallate, and filiform. So based on the size, the biggest size is circumvallate papillae. Then comes your fungiform, and the last one, the smallest one is filiform papillae. The fungiform papillae is mushroom shaped, right? And then it is appreciated by bright red color. It can be distinguished by bright red color, and it is basically near the tip and the margins of the tongue. The tip and the margins. Circumvallate papillae, sulcus terminalis just in front of them. If 4 are on left hand side, 4 will be on the right hand side. I am talking about the tongue diagram. So this is the biggest papillae or the taste buds. Then the filiform papillae is the conical papillae. So it is the characteristic appearance it has is a velvet appearance. It is one of the smallest. It is at the central part of the tongue, and basically very few taste buds are there. Foliate papillae are on the lateral border of the part of the tongue, contains taste buds, but it is very negligible. So foliate papillae are generally not considered as taste buds, but it is included in that. So please understand that. So one PYQ, circumvallate papillae are only 10 to 12 in number, but have maximum number of taste buds. So inside that circumvallate, circum means circumference, 2 rings will be there. So there will be lot of taste buds inside one circumvallate papillae. Next question. Posterior elevation and retraction of the tongue occurs by which muscles? You have a tongue, the tongue goes back, posterior elevation and the retraction of the tongue. So your tongue gets elevated and retracted by which muscle? And the muscle and the nerve also you can talk now. Right. So now you should know the tongue is made up of which all muscles. As I told you, intrinsic and extrinsic muscles. So individual actions of the muscles are very important here. So the options are genioglossus on the both the sides acting together, styloglossus on the both the sides acting together, styloglossus and palatoglossus on the both the sides acting together, or hyoglossus and styloglossus on the both the sides acting together. So for this, there's a diagram in your BD Thoracia book. Please go through that, and basically the answer is very simple. That is styloglossus and palatoglossus on the both the sides acting together will make the tongue elevated and retracted. Okay. So see this. Protrusion of the tongue, the same thing. The tongue you are trying to put out because of genioglossus muscle. Retraction is styloglossus. So this was part of our question. Depression is hyoglossus. Elevation of the tongue is because of palatoglossus. So that was our answer. Styloglossus and palatoglossus. So it was a combination of this table. And change in shape is because of intrinsic muscles. See how a question, you read a table, you know everything. But once it is mixed and 2 MCQs are mixed and they can, same thing, they can give a case-based scenario also. A person of so and so name, so and so age, met an accident, or under observation, he had some lymph nodes here, there, he will say, and on observation, his tongue was moving this side, that side, which muscles are involved or which is not working. So same thing. This table only, the clinical aspect, they will revolve around. So now, let's read a little bit about the muscles. So genioglossus muscle is the major muscle of the tongue, the most important, main bulk of the tongue is formed by that. So it has got upper fibers, middle fibers, and the lower fibers. 3 types, at 3 levels the fibers are there. And genioglossus muscle is also called as safety muscle of the tongue, the major muscle. Okay. Then hyoglossus, from hired bone it starts, it depresses the tongue. Palatoglossus pulls the root of the tongue. And then styloglossus for upward and backward during swallowing. So just learn this. In this previous slide also we have learned this. So please go through this. Intrinsic muscle shortens and makes the tongue dorsum concave. And then you have got inferior longitudinal shortens the tongue, dorsum convex. Verticalis muscle broadens the tongue, broadens the tongue. If tongue is like this, it will broaden and flattens the tongue. Transverse muscle narrows and elongates the tongue. So these are the basic things you should learn. So some PYQ, safety muscle of the tongue, which is called the safety muscles of the tongue, that is your genioglossus, and it is attached to the posterior surface of symphysis menti. Here, genioglossus, your geniotubercles are there. Where it is? Mental spines, superior geniotubercles, inferior geniotubercles are just above the lower border of the mandible. So it is basically the superior and inferior, four are there, two superior, two inferior. So it is attached basically superior geniotubercles. Next question, all are structures lying deep to hyoglossus muscle, except, so for this you should know the diagrams, okay? There's a diagram like this. So this is the tongue, this is your hyoglossus and all these muscles, this is styloglossus. The background is your hyoglossus muscle. You can see this is the genioglossus, the one which you're seeing where the cursor is moving. This is your genioglossus muscle. Okay. So now the question is, all the structures lying deep to hyoglossus muscle except. So answer is hypoglossal nerve, lingual, styloglossus, and these muscles are not. So see this diagram and the table is very clear. This. So basically it's a diagram based question. So based on the relations, this question is framed. Superficial or the lateral are submandibular gland, deep part of submandibular gland, submandibular duct. Deep or medial are genioglossus, lingual artery, structure passing deep to the posterior border of hyoglossus above downwards is glossopharyngeal nerve, which you are seeing in the diagram also. Styloid ligament, the green color one, and the lingual artery, the red color one in the diagram. So learn this diagram and correspondingly read this thing. Lymphatic drainage from the tip of the tongue passes to. So from the tip of the tongue, submental, the body of the tongue, submandibular. So that is the basic thing what you should know. So the tip of the tongue, submental lymph nodes. For this diagram you can know. So the apical vessels drain into the tip of the tongue and they go to submental. Marginal vessels, they go from the posterior or anterior two-third of the tongue and they go to submandibular lymph nodes. Central vessels from the anterior two-third of the tongue, they go to submental and jugulo-omohyoid nodes. The jugular vein is there, omohyoid muscle is there, muscles of the neck, so there it goes. And the dorsal vessels from the posterior one-third of the tongue, it goes into jugulo-digastric nodes. These are the key points what you should learn. Next question. When a patient protrudes his tongue, the tongue is deviated to right. It should not deviate, it should be straight. Protruded to right. So which of the following nerve is damaged? Left hypoglossal, it's going to right. So left hypoglossal or glossopharyngeal nerve total, right hypoglossal or facial nerve. So now we are going to protrude the tongue. Which muscle is responsible for protruding the tongue? That you should know first. Then only you can talk later. And that muscle, once you identify which nerve is supplying that. That is how you have to be. You can by heart this question. Okay, so that is what you should start thinking now. So the answer is right hypoglossal and the muscle is your protrude the tongue. Let me come back again. See, this is what I explained you just few minutes back. Protruding the tongue. Yes. So the same question can be converted into retraction, depression, elevation. With the genioglossus muscle, and genioglossus muscle is supplied by the 12th cranial nerve, right? Except paratoglossus, everything else is supplied by 12th cranial nerve. So this is what you should be knowing. Right hypoglossal nerve. In case of paralysis of the hypoglossal nerve, the tongue deviates to the paralyzed side. So that is the problem here. This is how it looks like. Next question. Impulses generated in the taste buds of the tongue reaches the cerebral cortex. So this is basically the taste pathway. You have got pain pathway. This is the taste pathway they are asking. So where it goes? Thalamus, internal capsule, cervical spinal nerve, or trigeminal nerve. Very simple. This is the taste pathway. So that is thalamus it goes. So this is your taste pathway. You have taste sensation. The taste buds will take it, and the glossopharyngeal nerve will carry the impulses. It will go to the inferior ganglion. Then from there, pactus solitarius. Then solitaro-thalamic tract, it goes to thalamus and it will relay to the postcentric gyrus. So read the taste sensation pathway. Okay, with the diagram. So which pathway, ascending, descending, everything. It is there in physiology also. Read the physiology part more in detail. Next question. This is from your embryology. Facial muscles are derived from second, third, sixth, or first arch. This is very simple. Again, it is an embryology question actually. The derivatives of each arch, you should learn it, make it, write it down in a sheet of paper and fix it on the wall. So basically, it is the muscles of the facial muscles are derived from the third arch, they are telling. This is not the correct answer. This is again not the correct answer. Facial muscles are derived from facial muscles. The facial muscles are zygomaticus major, minor, orbicularis oris. Okay, you have got here what you procerus muscles, mentalis muscle. So they are not supplied, they are derived from, see here, that is by your facial nerve. So facial muscles generally, facial nerve, that is the second arch. So the wrong option change here. It was actually the second arch. Answer became second. So this answer should be 1. Yes. So the first arch. So second, third, fourth. These are the nerves, arches. So the first arch is supplied by maxillary and the mandibular division of trigeminal nerves. Basically, these are all the muscles. So your muscles of mastication come here. And anterior belly of digastric is here. Please make a note. Then the facial nerve is the nerve of the second arch. All your muscles of facial expressions, they are here. So this is our question and this is the correct answer. Second arch. Then glossopharyngeal nerve, that is your ninth cranial nerve, stylopharyngeus. Superior laryngeal branch of vagus, the 10th cranial nerve, constrictor muscles of the pharynx and all it supplies. So this table is extremely important, right? In MCQ books, answers may be given wrong. It may be wrongly typed. It doesn't matter. This table, if you know, you can answer superbly. Even the bones and ligaments derived from the each arch, you have to answer. This is basically an embryology question. Next question, buccal branch of facial nerve supplies. So first you have to study the facial nerve here. So facial nerve, it starts from your brain and then there are 4 nucleus for that, right? The 4 nucleuses, it starts and then it comes down and then it passes and goes down and gives to upper branch, lower branch, and it passes through stylomasted foramen and comes out. And once it comes out from the stylomasted foramen, it goes straight over the tragus of the ear, enters the parotid gland from the posterior medial surface and give 5 branches. So that is what they are asking. Buccal branch of facial nerve. So buccal, we have 5 branches. So you have got temporal, zygomatic, buccal. So the buccal branch supplies which all area. So orbicularis oris, which is here, buccinator muscle, buccinator and superior constrictor, buccinator and quadratus labia superioris muscle. So basically like this. So the answer is orbicularis oris. You can see here orbicularis oris will be here and your buccinator muscle, which is on your cheek. That is the answer. This is the same thing. So same way, learn for other branches also. Next question. Muscles attached to the tubercle of the first cervical vertebrae. So this is basically the boxers muscles. When you see the Hulk and all the gym people who work very hard, they get the muscles become very prominent over here. So that is the question. Muscles attached to the tubercle of the first cervical vertebrae is your scalenus medius muscle. So scalenus anterior, C3 to C6, scalenus medius, which is our first question. Our question was C1 to C6. Scalenus anterior, C3 to C6 vertebrae it gets attached, but it is attached to the first rib. Your chest has ribs, right? So the first rib. So please see the same question can be asked in two ways. Scalenus anterior, which vertebrae and which rib? When it comes to vertebrae, it is C3 to C6, and when it comes to ribs, it is the first rib. And scalenus posterior is C5 to C7, and when it comes to ribs, the second rib. So that's why the muscles, the Hulk you will see, the muscle will be here. So that is because of the gym work, what they do, they get that. Okay. And that is called a fourth muscle is also there. That is called as Simpson's muscle. Just a high yielding fat. You can note this. Fourth muscle, generally anterior, medius, and posterior. The fourth one which has come is called as Simpson's muscles. Next question. Cell bodies bring accommodation to the near vision. So this is related to the eye now. Otic ganglion, ciliary muscle, geniculate ganglion, pterygopalatine ganglion. So because we are studying head and neck muscles only, so all the questions are from the muscles part only. So this options very clearly tells that it is from ciliary muscles. So that is not the answer. That is not that is the answer, but that is not the way you should read. That is what I am trying to tell. You have to read everything about myopia, right? Presbyopia, everything, the lens, near vision, distant vision, with cylindrical lenses will correct that. So the muscles of the eye, extraocular muscles, extraocular muscles again, voluntary, involuntary. Entire thing you should study. You can't just read this particular question and leave it like that. So sphincters and dilators pupil muscles are derived from which layer? Basically an embryology question. So this is nothing but your neural ectoderm. So you see here, the sphincter is a part of the eye called the iris, and this is it has pupillary sphincter, pupillary constrictor, circular muscles of iris, and circular fiber. So there are four functions. The constrictor muscle, which is basically except sphincter and dilator pupil, all the muscles of iris are derived from mesoderm. The sphincter and dilator pupils are derived from neural ectoderm, which is our question. So please learn this. This is from neural ectoderm, which are two, sphincter and dilator pupil. And all others are from mesoderm. Next question. Which of these extraocular muscles is not supplied by oculomotor nerve? So for this, you should learn it in a nice way. Extraocular muscles. There are basically 10 muscles. Superior rectus, middle rectus, inferior rectus, lateral rectus. Superior oblique, inferior oblique. Right? And then you have got tarsal muscles are there. Tarsal muscles. Superior, inferior, and levator palpebral, superior axis. So like that, all these muscles names, you should learn it perfectly and their actions also. Yeah, so which of this extraocular muscle is not supplied by oculomotor nerve? So basically you remember SO4 LR6. Superior oblique is supplied by fourth cranial nerve, that is trochlea. SO4. And then LR6. Lateral rectus is supplied by sixth cranial nerve, that is abducens. And all the others are supplied by oculomotor nerve. So that is the basic thing what you should know. So here the answer is superior rectus is not supplied by oculomotor nerve because superior rectus is supplied by the trochlear nerve, SO4. So this is the same thing what I told you, SO4, LR6, and others all by third cranial nerve, that is oculomotor. Next, so these are the actions and the functions of these muscles, right? So upward rotation, downward, medial, lateral, intorsion, extorsion, all those things. This muscles, you should learn it in a very nice manner. This thing again, I will teach you in the oral surgery also. I will teach you, because whenever there is a fracture, the muscles of the eye gets disturbed, right? So the torsion test is there, post-duction test. So all those things in oral surgery part I will be discussing. So basically, right now you take the muscle and learn the actions, and with the actions learn the muscle. So this table is there for that. Next question: depression of the mandible occurs with. So now we are into muscles of mastication. So depression of the mandible. So now please understand that your maxilla is fixed. Only your mandible keeps moving. The mandible keeps moving. So only your maxilla, my upper hand is maxilla, that is fixed. Mandible keeps moving. So now, when I am telling depression of the mandible, so that means the depression of the mandible means the mandible is going down. This mandible is going down. So the mouth is opening. And when I am telling elevation of the mandible, that means mouth is closing. So depression of the mandible occurs with lateral, medial, masseter, temporalis. So this whole chart you can learn this. Okay. So mandibular elevation, closing the mouth, is by MTM. M, medial pterygoid, masseter, temporalis. So here, this is the question is derived from this particular part only. The lateral pterygoid is not there. MTM, the lateral pterygoid muscle, is not responsible for opening the mouth or depression of the mandible. So similarly, other parts, please learn this. Okay. This will help you to really understand the questions better with this table. Please learn. Same thing again, the origin, insertion, action, and the nerve, the which nerve is supplying that. So which of the following muscle has dual nerve supply? The digastric muscle has got anterior belly of digastric, posterior belly of digastric, and both of them are supplied by different radial nerves. Find out that. That is your task to know that. Fan-shaped muscle, genioglossus muscle. An arterial plus an inferior border of masseter. So when you clench your teeth, you have masseter muscle. Just anterior inferior here, if you put your 3 fingers, you can feel the pulsation of facial artery. Here is the place where the facial artery pulsates. From here, the facial artery enters the face from the neck, and it goes towards the angle of the mouth, and then on the lateral surface of the nose it goes and goes up to the eye. So that is what facial artery. The tendon of which muscle glides around the pterygoid hamulus? This is the question. So you can see from this diagram, you have the pterygoid hamulus is somewhere here. Yes, this is the where. So which muscle glides around the pterygoid hamulus? So the anatomy part, the diagrams part, you should learn very correctly. The answer is tensor villi palatini muscle. This is basically from your soft palate muscles what they have asking. Soft palate. Again, read the muscles of the soft palate. What is the function of muscle marked in picture? So this is basically your scan one, that is MRI scans. Okay, MRI scan, but they have put it in a diagram format. You should know which are these muscles in the scans, MRI scans. Okay. So this muscle you have to identify, and then you have to tell what is the function of that muscle. So it's a indirect question. First you should know the muscle, and then you should tell what is the function. So let us go into the scan first. Yes, this diagram, if you know, you can tell the muscles. So you see here, this muscle is your medial pterygoid. Above that is your lateral pterygoid, and then above that is temporalis muscle, and this one is your masseter muscle, because this is taken like this, in a sleeping position, right? So this is the nose. So masseter, temporalis, lateral pterygoid, medial pterygoid. In that order it is. They'll ask you a muscle and what is the function of this. Then you should first identify the muscle and then tell accordingly. The same thing. Next question. A trumpeter. Trumpeter means who will blow from the mouth. It's a musical instrument. Couldn't do his routine work because of damage to the which muscle? So the whistling, blowing muscle it is basically. So it is the buccinator muscle is the answer. Buccinator muscle or cheek muscle is also called as trumpeter's muscle or nursing muscle also. Okay, so this is one new thing which you can learn. It's also called as nursing muscle. The original insertion of that muscle, you need to learn that. These are the same way the muscles of facial expressions. They can show you a photograph and they can ask you which muscle is responsible for that. So smiling muscle is your zygomaticus major. Sadness is your levator labial superiorus. Pride is your platysma muscle. Surprise, your frontalis muscle. Frowning, you do like this. This eyebrows you put up and down. That is frowning. Corrugator supercilii. Procerus here. That is dislike. You don't like it. Chi, you call it like that. Whistling muscle, the buccinator. And then other, your grinning. Grinning means you do like this. This muscle. Grinning. Rhizorius muscle will help in that. So which of the following are dilators of the mouth except? Sphincters and dilators. Sphincters are circular muscles, dilators are radial in arrangement. That's it. So orbicularis oris is a circular muscle, so it is a sphincter. Mentalis, rhizorius, labial superiorus muscle are dilators. The question is which all of the following are dilators of the mouth except. So answer should be orbicularis oris because it's a circular muscle. Circular muscles are sphincters and other direction muscles are called dilators. This is what it is. Then this spot, modulus, is a spot where 8 muscles come and meet. And the 8 muscles are, they will all come from different directions and they will come and meet. So they are orbicularis oris, depressor anguli oris, levator anguli oris, contralateral labia superiorus, contralateral labia inferiorus, buccinator, rhizorius, and zygomaticus major. This is a very important MCQ also. Okay, so learn all these things in and around questions. Activation of the following combination of the muscles are required to smile. Okay, so you have smile is zygomaticus major muscle. So from the option, the first one is zygomaticus. The first one, this third option, zygomaticus major is not there only. So that is the wrong answer. First of all, take it out. Then zygomaticus major, zygomaticus minor, and then rhizorius, orbicularis oris. So activation of the following combination of the muscles are required to smile. See, when you smile, zygomaticus major, minor, and then your most important muscle is, see, when you're smiling, orbicularis oris and your rhizorius muscle, this part. Grinning, what you do here, this part. This muscle is rhizorius. So these 3 are the ones. So this is actually a clinical question. You have to learn accordingly. So the more number of MCQs you do, you will get into this. Textbooks you will read directly. Okay, smiling is this muscle, that is that muscle. But here you see how questions are twisted. So frowning and smiling. See, for frowning, all these muscles comes into play. For smiling, this muscles comes into play. So learn this. Okay, these are all special questions, different questions, not a regular questions. That is why it is included in this session. Wry neck or deformity is due to damage of what? Wry neck means torticollis. That means your sternocleidomastoid muscle, the spinal accessory nerve gets spasm. It's not giving the supply, and the muscle gets spasmodic, and the neck shifts to one side. So that is basically damage to sternocleidomastoid muscle. That is the answer actually. Sternocleidomastoid, yes. Which is not anterior triangle of neck? Oh, so very simple question. So anterior triangles of the neck, you have got four triangles, anterior and posterior triangles, two are there. Anterior triangle is submental, digastric, carotid, muscular. So your subclavian triangle is not the anterior triangle, that comes into your posterior triangle. The contents of these triangles also you should learn, especially carotid triangle, where carotid artery is there, ansa cervicalis is there, carotid sheath, all those things, your ansa cervicalis, which all areas, which all muscles it supplies, that part you should learn perfectly. And the contents of each triangle, you should know this. Okay, so today, variety of chapters we have discussed, so many questions based on the tongue chapter we have discussed and the muscles we have discussed. So don't read chapter by chapter, read muscle by muscle. So take a group of muscles of mastication and master that. Read in and around, especially don't by heart the functions. By hearting will not help you. It should be clinically applied. Then only you will be able to solve all the clinical questions. Okay, so this session for today is just to give you exposure how questions can be manipulated and twisted and turned, and it can be taken from the table and it can be framed into a case-based scenario. So try thinking in that way also. Okay, so that's all for the day. So read well. Next session we'll come up with one more topic. Okay, thank you.